Hey there, and welcome to the Fiihr Factor, the podcast that shines a light on real stories, smart strategies, and the occasional hard truth about running a business. Think of this as your quick dose of clarity before your first cup of coffee. Let's go. Today, I have the privilege of speaking with the COO of Cellarian, Mr. Mike Liu. How you doing, Mike?
I'm doing well. Good to see you again, Warren.
I really appreciate you taking the time. I know you got a great story to tell, so we'll jump right in. First of all, just tell me your journey. How'd you end up as COO of this company?
So, I'm a licensed healthcare administrator. Like most kids, I was told at a very young age from my family, you're going to be a doctor. So, I went pre med, I went to college, followed some scholarship money, went to medical school at the University of Texas, Houston, and I matriculated into medical school. While I was in med school, first year student, I started running a homeless student run clinic that was a collaboration between two med schools, a couple of nursing schools, social health, public health school. And I became one of the student leaders of a student run homeless clinic. And
Wow.
I had so much reward, so much enjoyment out of doing logistics, doing operations, coordinating care, and being on the business side of it. So, I grew up in a family where we all owned small businesses. I think in our case, that whole stereotype of Asians owning restaurants and all that. Well, it happened to be true in my family. And so
Dry cleaning? Just kidding. Yeah.
no dry cleaning, but restaurants, supermarkets, and convenience stores. Yes.
Okay. Nice.
But
Entrepreneurs. Yeah. Love it.
entrepreneurs. And so, I mean, it ran in the blood, it was in the veins. I decided, I was like, you know what? I just finally figured out what I loved. And it wasn't
Mm.
writing prescriptions. It wasn't seeing patients. It wasn't, trying to squeeze, 35 people in an 8-hour block and then, writing and finishing up their medical charts at the end of the day, right? So
Mm.
I found what I loved in healthcare administration, picked up an MBA in healthcare management, picked up a second master's in strategic management from Harvard, and worked for McKinsey, went around the country doing management consulting, helping to build, scale, or sell medical practices. I love the business side of it. Been a bunch of interims along the process. I've run hospitals, I've run surgery centers, I've run multi-practice practices and large healthcare entities. And now I run a healthcare tech company called Cellarian.
Isn't that funny? So, by the way, quick question. You mentioned you help these businesses sell. If you had to, I want to capture this because I think it's super important. You talk about, especially like a medical doctor's office, whatever, trying to sell. I hear a lot of people say, well, I don't really have much value. I have this patient list, I guess. But I think you could really elaborate on that because there's a lot more value there than I think people think.
So, absolutely, it is illegal in America to sell a list of patients. So, actually, for a doctor, for any clinical practice, the most valuable thing you actually have is that patient list. So, the recommended process is to take your last 2 years of tax returns, your profit and loss statement, your balance sheet, and have an independent third party valuation company or CPA company do a valuation on your company. So, and then let's say the industry, it's all a little different based on where you're based, how many patients you have, but there's typically a multiplier, right?
Sure.
So if your company has this much in gross revenue, this much in assets, you'll probably get 3.5, 4.5x of your EBITDA in terms of the valuation of your practice. And once again, the more patients you have. So a practice with $3 million and 2,000 patients versus a practice with $3 million a year and 18,000 patients. That's a much more valuable practice. And then there are other things as well. Payer mix is important. So a practice that sees
Mm.
high PPO, high cash, high Medicare, those are all things that increase your multiplier. So when you work with a management company, when you work with somebody like me, or you work with somebody that is in the business, they increase your valuation by teaching you how to structure payer mix, what to take, what not to take, what procedures to do, what ancillaries to do, what to own, what not to own, staffing ratios, all of that.
Yeah, it all makes a difference. It's nice to hear somebody talk about, because I've got some doctor friends and they're like, well, I think I'll just kind of fade into the night. It's like, no, dude, step on the gas, up your patient count, and you might have a sellable asset here worth some money. So thank you for that. That's kind of a personal thing for me. Okay. So well, how did you end up then as COO of this company? What
Um,
brought you to that?
Yeah, so I was resigning from a large healthcare firm, and I was running a practice that was completely burning me out. It had 10 primary care practices, it had a hospital, it had some other things, and it was just wasn't good for me and two young children. So I was like, if I stay here, I'm gonna ruin my marriage. I need a
Hmm.
job that allows better work-life balance. I just started coaching my son's tennis team, and I was like, look,
Uh,
I can't do this. So, I resigned as the chief operating officer of a healthcare chain before I had anything lined up. Well, I
wow.
resigned. I was starting to let some of our vendors, our clients know, and all this stuff. And we were the first client for a company called Cellarian. So the minute the CEO found out about my resignation, he reached out. He said, "Hey, I would love to work with you." We started talking, and 3 months later, came in as the chief operating officer for Solarian, and now we try to build solutions. We build medical necessity, automation, and documentation solutions for clients all around the country.
Wow. So, first of all, back to the practice, running a practice like that. What was the hardest thing about that? Was it dealing with the doctors?
I will say dealing with unscripted behavior. So when we talk
Huh.
about behavior, there's the behavior of the patient, there are
Yep.
behaviors of the employees, and then there are the behaviors of the doctors. I think the glamorous things that I think most people want to hear about is, okay, well, how did you get this doctor his medical license back? Or how did you help with this lawsuit or that Medicare investigation or this audit from the payers? I mean, I think that's kind of the big and the fancy and the glamorous stuff, but there's also the day-to-day where you're helping a patient who actually just hit your staff. And by the
Hmm.
time you're done, if you've done a good job, that patient's apologizing to your staff. You didn't fire the patient, and and your staff didn't sue the patient. There are incidents, as you can imagine, the the dynamics of people working together, and this person having an affair with that person. I mean, it's all the things that you have in large businesses.
Yes.
There's drama, there's conflict, there's insurrection. They're the people that says, I just published this policy, why did you do that against what you were just trained on
Yes.
this, yet you went on and you put that on your social media and you violated 14 laws from HIPAA, right? And so
Oh my gosh, I could tell you so many stories. And it's so funny how it doesn't matter whether it's a medical practice or a television station or a CPA firm or whatever. It's always the same. The people stuff is always the people stuff. And I like the way you call it unpredictable behavior. That's definitely people. That's for
yeah.
sure. And
You know,
now you're
it's
at a
funny
company.
because if you were to give me the option of managing people or problems, I'll take problems over people because, the solutions with problems have a lot less emotion, a lot less side effects, a lot less, let's call it collateral damage. Dealing with people, it's hard. It's important. I will say this: if you're good with people, we need people with good people skills in leadership. I sit on a board.
Yes.
I help young healthcare administrators. I mentor, young healthcare workers and all that stuff. And from the very beginning, what I'm always telling them is, look, your people skills, how you dealt with friends, how you dealt with enemies, how you dealt with girlfriends, boyfriends, bosses, bullies, that's going to help you so much as you run operations in any entity, right?
Yes. Yeah, it's funny, thinking about emotional IQ, for instance, and that plus like how you communicate with people and how they communicate and how you can kind of pick up on different communication patterns is such a critical piece of business and growth and leadership. So I'm with you 100%. All right, so now you're at this company, Solarian, and let me try to see if I describe what you do correctly. So, as I understand it, people, if you're going to run tests on a patient, you got to have medical necessity, and sometimes that medical necessity is not always documented correctly, and then you don't get paid. And so you got an AI, kind of an AI way to do that. Is that correct?
Almost. So you got
Oh,
90% of that correct.
that's an
Um,
A.
no AI, right? So we are
Oh,
a
okay.
clinical algorithm, and I'll explain that in a second.
Please.
So here's the problem. We've all had denied claims. You've had it where you need an MRI done to get a surgery. everyone's had it where like they need surgery, but the insurance company denies payment, or they deny the pre-auth, or they deny something. We've come to a point in the American healthcare system where the payers control the entire healthcare system, right? Everything is controlled by what Blue Cross Blue Shield, Medicare,
Mm.
United, Cigna, Aetna, Humana will agree to. Centene is the largest coverage. They manage more of the managed Medicaids in the country than anything else. And
Huh.
I think what's hard is when you look at this, they're no longer nonprofit like they used to be 40, 50 years ago when managed care came out in the 80s. They're all for-profit companies. And when you look at United Healthcare, I mean, look, like blessings upon the Thompson family, what happened to that CEO.
Sure. Of course.
But what
Yes.
is really hard is when people look and last quarter, they made $8.2 billion in a quarter, right?
Oh,
And so their business model, and it's been this way, and you can look it up, anyone can look it up. This business model for the last 10 to 15 years has been to collect premiums and to deny payments.
hmm.
It is unfortunate when the average doctor has 7.2 minutes to see a patient. You cannot document well enough. So what we do is we don't make stuff up. When I'm a licensed compliance officer, and when we
Mm.
talk about compliance, compliance is about doing something to a standard. What is the standard for accounting? What is the
Yeah.
standard for a 15-foot free throw shot? What is the standard, for an NFL football field, right? There's standards. So in healthcare, there are standards when it comes to what you have to document for. Our solution is called patient specific and payer specific. So basically, we look at the medical record and we document for all the reasons why a patient needs a test. And then we document based on what the doctor has ordered, the medications, the ICD-10s, the diagnosis, and then it's payer specific. So part two, the secret sauce is really we take the guidelines by your insurance company, Cigna,
Uh,
Aetna, Amerigroup, Molina, Oscar, and we document based on the required published guidelines. Now, all state, it's not a secret what we do. The state insurance agency, so here in Texas, it's called TDI, the Texas Department of Insurance, requires every single payer has to publish their guidelines. We take those guidelines, we meet it up, and we create medical necessity documentation for toxicology, molecular testing. We're creating it now for pharmacogenomics. And we have clients all the time asking us, hey, we need you to create this for surgery, for ambulance transfer, for outpatient diagnostics, for all these different things. Because a doctor, when you have 7.2 minutes, what are they doing at night? They're seeing 35 patients. They go home, they eat some dinner, they spend time with their family goes to bed, and then they spend the next 2 hours finishing their chart notes because they're trying to remember what they did at 2 o'clock and 3:30 and 4:15. They're trying to finish their chart notes for the day. And I promise
wow.
you, having been in it, having managed, in upwards of 400 doctors at a time, they don't have that time, right?
Yeah.
We've all heard the numbers of how we are 30,000 healthcare providers short right now. And that number is going to continue to escalate with the aging of America and the
Sure.
fact that people are leaving. It is very sad when the average medical doctor in America works less than 6 years.
Really, I did not know this.
Yeah.
They get out of the they get out. They went to all this. They went to all this school and all this training and spent all this money, and they're in there. The average one's in 6 years.
Yeah. And so no, they leave clinical care after 6 years, right?
Okay.
They
Okay.
they end up doing other things, right? Because there are opportunities to be a medical director, to do consulting, to do this, to do trials. But
Uh,
it is sad when you've put so much of your life into something and you leave clinical practice an average of 6.2 years.
my gosh, and I'm guessing it's two things. It's number one, the doctor doesn't want to just spend 7 minutes with a patient because, like, what can you really do in 7 minutes? Not much, right? And then doing all this paperwork. So you're alleviating the second one, and they get paid. The hospital or whatever or clinic gets paid more regularly, and they don't have to jack around with the insurance companies as much because you already met all their requirements.
Absolutely. And so what we document for every analyte, every test, and all the appropriate reason. And if it's not medically necessary, we just don't document for it. So like we're not going to make anything up. Once again, it's a
Yeah.
compliance tool. So I love it because law firms will call us and they'll be like, "Oh, my client is under audit. how am I going to get this when all the doctors that send them these orders, won't send us medical records, can't document well enough? What is required is the submission of medical necessity, not chart notes,
Yeah.
not doctor's notes, not progress notes or anything like that. And so we have an automated tool. And once again, it's not AI. It doesn't hallucinate. It doesn't make it up. It is patient specific, payer specific. It's a compliance documentation solution.
So I like I like the fact that you're very clearly, distinctly stating this product actually is not AI
Yeah.
because it's got to be completely accurate. And AI, as we know, is not completely accurate. So I think that's a great distinction. Okay, so how do you take this thing and scale it? Like, how do you go to market with something like this? I don't know how
Great
far you
question.
were in the company when it started, but tell me about that journey.
Yeah, so the company formed in 2018. From 2018 to 2022, we did data visualization. Long story short, there wasn't a market for it. The market
Wow.
told us we didn't need this. There are other products out there that are better. There are other products that there are industry giants you can't compete with. So we did a major pivot in 2022. The three principals, myself, the chief operating officer, the CTO, and the CEO, we bought the company from the founders. We did a restructure in 2022. So basically, we are the founders. And what we did is we're like, okay, where's there a need? And where are people asking us for a solution? And
Mm.
everyone keep telling us, well, you know what? We keep getting denied claims. We don't have a solution for this. And so Cellarian 2.0, right? We recreated the company based on what the market was asking for, which was a solution that was going to actually make them money. Because if you can provide medical necessity documentation, you can get our claims paid, we can be viable and we can pay you. We can pay you for these services. And, the first few clients really took the biggest risk. So we gave them a great deal on it, but it was okay, do we give this to you at this price or this price? Should it be subscription or should it be per click? And
Ah.
there was a lot of work, as you can imagine, with consultants, with compliance officers, with attorneys, for us to create a product for the market that was, once again, a compliance tool that they could use and they could monetize, that protect their license, that documented for all of their patients and kept both the diagnostic tests appropriate as well as protecting their clinical liability.
Wow. So so this company collected data for 4 years, thought they had a product. The product was not what the potential customer wanted. You bought the company, you iterated the product to fill a need, and 2.0 is set. So then how did you scale it? Or how did you got a few customers. So that was first. And then what?
Yeah, and then we went to where the customers were. We went to where the customers and their billing companies were. So once again, we knew that this was a solution that was going to have to be organically grown within the industry. We were not direct to consumer. So things like SEO, SEM, direct to consumer advertising, social media, those things weren't going to work. We were a
Yep.
business to business tool. So, like with any business, when I tell a young graduate, associate, business owner, who's your customer? Okay, are you a B2C? Are you a B2B? Are you a direct to consumer? All the things that we have to understand in business, right? And you can get an MBA like me, but you don't need it. You just need to understand who is your customer, who's going to use the product. Our board chair is fabulous because our board chair simplifies everything. And
Mm.
he was one of the first execs to help create Excel back in the 80s, and fabulous, fabulous
Wow.
guy. But he's like, will the dogs eat the dog food? Will the dogs come back? Will the owners pay for the dog food? And so
Ah.
we had to go through those iterations. So from 2018 to 2022, we packaged that product, we flushed it down the toilet, and in 2022, in August, we restructured and we said, okay, let's create this new product with medical necessity. Let's create it in an agnostic tool. Let's create APIs for it. Let's be able to interface with any LAS system, any EMR system. Let's do these things that clients actually need. Let's price it accordingly. And we know that we're gonna be very, very thin for a while until the clients grow. after we had enough traction, we had thousands and thousands of reports that were accepted. We won audit after audit, denied claim after denied claim. We took it to market. And then once you take it to market, once again, it's how do you scale? Then, you know, as a startup, you're scaling the company. So it was the three of us going out and going to trade shows, going to conferences, doing white papers, running our own website until we could bring on our first sales guy. And then, so then it just kind of grows from there.
Yeah, and it's customer referrals or at least recommendations. It's finding other maybe finding the places where the customers are and going to those places and then showing why your product is superior and then showing ROI, right?
And it's amazing. I mean, like that whole saying of, oh, it takes 10 years to become an overnight success. Well, it it took us it took us 8 years to get there. I mean, like, it's really true because I don't think for any business, right? Ford today is not what Henry Ford originally intended it to be. Apple
Yes.
today is not what Apple was when Jobs and Wozniak started it in the 80s, right? And so every company will evolve. And I think as your job as a leader in that company is, what do I need to do to make money today? And then what do I need to do to adapt to the market to make money tomorrow? Now, you and I see this. We've already talked about it twice on this video is we all know that doctors are burnt out. We all know that AI is here. It's not coming, it's here. We all
Yep.
know that you have to service the patient, right? So like how do you create your product as each market is changing, right? So like, and you have these pressures in agriculture, you have these pressures in health tech and construction and design. I mean, every industry has their own pressures and their own ways of dealing with market changes.
Yeah. So then here's the thing that I think gets interesting then. So you start to grow and probably start to grow pretty quickly, I'm assuming at some point. Then what did you do? Because that it's hiring the right people and building the right team. I think that you had your trio, the three amigos. But then where did you go from there to hire the team and say, okay, now we got to roll?
Yeah, and I think that's really the next question is, do you create strategic partnerships, right? Or do you just hire a whole bunch of Johns and Harrys and Moes and Curlys, right? And so we did one strategic hire of a sales VP. And then we did a lot because we're a referral based business. And so we did a
Yes.
lot with major strategic relationships that already are leaders within the industry, right? So I think every company is a little bit different. I think for everybody, you're going to have to look at, okay, how do I grow the fastest? Because it really takes, if you look at 6 months to truly onboard somebody, like, to leave a
Yes.
sales guy by themselves where they can really talk about your product, you have to handhold that person to 4 to 6 months, right? And so,
Yeah. Yes.
we had to make those decisions and say, okay, no, no, we're going to do one key hire, and that key hire is going to oversee this. We'll take care of the enterprise customers up here because where we really make money, that sales guy can handle all the ones that will do 100 to 5,000 reports a month, but
Yeah.
all the big whales out there, the 5,000 to 2 million reports a month, we have to handle that on an enterprise level, and that's what I do. I mean, I'm dealing with channel partners, strategic partners, referral partners, revenue cycle companies, EMR companies, licensing. So like we deal with the enterprise
Hmm.
stuff up here.
So I I can't help but I got to capture this because I mentioned you guys as a three amigos and then you gave names of the three stooges. So I thought that was pretty subtle. A good joke. So here's a question though, because I think the referral partner in the scale is so important for so many companies. How do you build up good referral partners and what's your sort of strategy to do that?
Great question. Who is your mutual customer? Right? So for us, we're like, okay, who interfaces with laboratories like we do? Who interfaces with doctors like we do? Who interfaces with healthcare systems and insurance companies like we do? Right? So like, oh yeah, we can get a company full of business development guys, marketing guys. We can get channel partners that are in other health software just like we are. We can get channel partners that are, also that work to support medical documentation, right? So you don't have to reinvent the wheel, right? Because once
Hmm.
again, you have liability of employees, You've got their salary, you've got payroll tax, you've got all the things that you have to deal with. When you just cut a deal, okay, sure, yeah, we'll just rev share. You get 10% of everything that I make. It's so simple. And all they have to do is
Yes.
make the introduction, right? And so there are a lot of ways to scale. And I think for any business owner, the question's always, what is the easiest way for you to scale? Right? Because there's only so many of you, right? So you can't replicate the founder, right? So how does that
Right.
founder become more effective, and how do you create a tiered system? So for our business, channel partnerships, strategic relationships allowed us to scale and get to thousands of customers a lot faster. And we also live in a day and age where digital is great, right? But we had to be very strategic in what we communicated, because once again, we communicate in these channels, yes, and those channels, no, because once again, we're not direct to consumer. So, you know,
Yes.
we only communicate where decision makers are, business leaders are, healthcare decisions, CFOs, CEOs are, right? So once again, you have to be very strategic in where you go and where you do not, because once again, there's only so much of your time, and everything's a black hole for your time.
Oh my gosh. Yeah, 100% agree. Okay, so one question, then I'll go to the speed round. Number one thing you would have done differently as you were growing this company.
Wow. Taking in more investment capital. I think everything takes longer to deploy and takes more capital than you realize. And look, I'm a penny pincher, right? So I I did as much internally as possible, but I think it takes longer to build things. It takes longer to test things. If you're a product and you need a quality control test your product like we did, right? Building out UX, UI, quality control testing, testing with customers, testing in the field, all of that takes time, right? All of that's going to burn through your cash, right? So make your plan, and whatever your plan is, make sure that you add 40 to 50% more startup capital than you need, because you're going to need it,
I
right?
love it. Yeah, I always say it's going to take twice as long, twice as much money, and be twice as hard.
Absolutely.
And and then some people are saying that's too low. So it just depends. Okay, a couple quick questions, very random. If you were an animal, what animal would you be?
Oh, wow. Gosh. I'm going to say a porpoise.
A porpoise. Very nice.
Social, fun, likes to jump out of the water, and likes to travel in packs.
I like that a lot, actually. And porpoises have been known to save people too, occasionally.
Yep.
So that's pretty nice, right? They help each other. That's beautiful. And then when you are gone, what do you want to be remembered for?
Great question. I hit 40, and when I hit 40, I had a crisis of that question. What is my
Nice.
legacy going to be? So for myself, I want to make sure that I've impacted not just people. It's easy to impact people, but I wanted to have an impact and create change in an industry, right? So I turned down hospital jobs, I turned down health system jobs, I turned down things because like, you know what? I wanted to create a solution in an industry. I wanted to create something that did not exist, right? So I think for all of us, we all want to make an impact with the work that we do, because we spend so much more time, right? Because between the ages of basically 25 and 55, you're going to spend so much more time with your coworkers than you will with your family, right? So if
Yes.
that's going to be the majority of your time, is it going to be worthwhile? Are you going to make an impact in whatever field, industry, organization that you're a part of, right? And whether you're there to change culture, whether you're there to change business trends, to build infrastructure, be there to truly make a difference and leave an impact.
I like that. And I feel like with this company, based on everything you told me and the fact that you can actually make doctors' lives easier and more fulfilling and let them do maybe more of what they love.
Yeah,
Uh, that's a beautiful thing. And then maybe, hey, maybe patients get a little bit of better care too.
absolutely.
That's wonderful. Hey, Mike, thank you so much for the wisdom. I really appreciate your insight. I love how you scaled your company and how you built something that is not only makes money but filled a need and is changing the way we do, the way we do medical in so many different ways. I thoroughly enjoyed it. This went really fast. A really great time talking with Mike Liu today. And I'll tell you what, smart guy that is focused on the right things. And that is, hey, what does our customer want? Will the dogs eat the food? Will they come back for the food? And will the owners buy the dog food? Such a simple concept, but that's what it takes. Pivot the product to what the consumer, or in this case, the business owners, medical practices want. Figure out a need and fill that need, and then figure out how to market it and scale it once you have it in the hands of the folks. And that means referral partners. I love the referral partner strategy. How do we create a win-win? And that's the best way to scale, especially B2B.
Liked what you heard? Let's make it real. Schedule your free coaching session today at sugarland.actioncoach.com.